So I'm going to be recording my patient education for case study 2 on the 3 things that I would talk about. So the 3 main things would be the bleeding index and associated with his high blood pressure, the x-rays with the bone loss, and then a little bit about his diet and how that kind of like correlates with the biofilm buildup with his plaque index and all of that. So to start, I would pull up the perio chart and take a look at his bleeding, and his bleeding index was 65%. So I would start to kind of talk about how all of those areas are bleeding kind of represent where there is some inflammation present on his tissue, and we want to try what we can to minimize all of that inflammation because he does have high blood pressure. And what happens is whenever that bleeding occurs, that allows bad bacteria to enter into the bloodstream, and the more bacteria that kind of enters in and starts to build up in his arteries can lead to plaque buildup within the arteries, which can actually increase your blood pressure even more and can cause a medical emergency. And so we want to try to decrease those bleeding points and decrease that inflammation present to prevent the amount of bad bacteria that builds up in the arteries. And also with the high blood pressure, that is an inflammatory disease that's already present in your body. And so with the gum tissue being inflamed as well, your body can only handle so much. So we want to decrease that inflammation in the mouth so that way your body's not having to kind of take care of and try to like handle so many different things at one time because it can only do so much. And then with that, I would pull up his x-rays, and here are his x-rays, and I would kind of talk about how his bone loss isn't that. I would first explain where the bone level should be at, and then where his bone level is at, which is just slightly below where it should be, right, which is right here. And I would explain to him that with his plaque index, which was the solution that kind of shows which areas in the mouth have bacteria buildup in plaque, which we like to call biofilm, you had 70% of your mouth was filled with plaque buildup. And so what happens is with all of that plaque buildup can cause irritation and inflammation to the tissues and the surrounding structures of the teeth, which can kind of start to erode away the bone. And so the bone loss that's present here is due to all that inflammation and that irritation from that bacteria and biofilm buildup. And the more bacteria that's present and the more inflammation, it kind of like starts to eat away at the bone, and it's starting to cause a little bit of bone loss. It is slight right now, which is good. We want to try to arrest that and prevent any more destruction of that bone. And so to do that, I would, go into explaining like different toothbrushing and like flossing methods to try to decrease that biofilm buildup, decrease the plaque index. We typically like to see like anywhere from like 10 to 15, kind of like in the lower numbers, but 70% is quite a lot in the mouth that has bacteria buildup. So we want to decrease that. And then next I would go into a little bit more about his diet and how that also correlates with the plaque index. And so in his diet, he says that he likes to drink cola and acidic, sugary drinks and like energy drinks. And so I would explain that anytime that you are drinking soda, or any kind of like drinks that have sugar in it, or any foods that have like that sugary food, it causes your environment within your mouth to drop to an acidic level. And bacteria love to thrive and flourish in acidic environments. And so the sugar kind of feeds the bacteria, and they kind of feed off of it and start to multiply and grow. And then that causes an accumulation of bacteria to build up around your mouth. And since you drink the sugary drinks all throughout the day, every time you're sipping on it, it causes that acidic environment to be in your mouth. So you're kind of having that environment present all throughout the day, which is just allowing the bacteria to kind of feed and thrive and start to multiply and grow. And that will lead to demineralization that can kind of start to erode away at your tissue, or not your tissue, your teeth, your outer layer of your teeth. And with further progression of that, further buildup of the bacteria, that will lead to decay and cavities. And on your x-rays, I do notice that there are some restorations, so you have had previous instances of decay. And so we want to try to take all the measures that we can to decrease or prevent future decay from occurring. And so if this was an actual OHI, I would go into like all the different methods that we can take, toothbrushing with flossing, to decrease all of that buildup, and kind of do more of like nutritional counseling to kind of like talk with him about decreasing the amount of sugary drinks that he intakes on a daily basis. And then with that, I would also kind of relate his smoking to how that can cause a dry mouth and cause xerostomia, and that also, having the dry mouth, kind of decreases that salivary flow, and the saliva kind of acts like a pH buffer. So whenever you are drinking soda and that acidic environment kind of occurs, your saliva helps to bring it back up to a neutral level. But with the dry mouth, your salivary flow is decreased, and so without that, your mouth kind of stays in that acidic environment for a longer period of time, which can cause decay to develop. And so with the smoking, that we want to try to, I would also kind of talk about tobacco cessation and limiting his amount of tobacco use, because with the xerostomia, that would cause, it would cause an increased risk of decay to develop. And also with smoking, whenever he does smoke, every time, that causes more and more bad bacteria to enter his mouth, which can start to erode away the bone. And every time, the more that you smoke, that increases your risk of more bacteria starting to eat away at your bone. So right now, again, it's just light, but we do want to try to arrest that and prevent any future loss of that structure around your teeth. And that is about it.